So hello everyone, this is your Krishna from Women Today YouTube channel. So in this channel we have been interviewing many women entrepreneurs and working women across different cities in India. We are just traveling to different cities and we are doing offline interviews, and we are also doing online interviews across different cities in India and also across different countries in the world. So today's our guest is from Hyderabad. Her name is Dr. Parul Pandey. So I welcome you, Dr. Parul Pandey, to this Women Today YouTube channel. So she is the founder of Caracare clinic, which is located in Kukatpalli in Hyderabad. So right now we are in her clinic. So once again I welcome you, Dr. Parul Pandey ma'am. So please kindly introduce about yourself, about the kind of work that you're doing to the audience who are watching this interview right now, ma'am.
Hi everyone, myself Dr. Parul, and I am a root canal specialist. So I have done my BDS, my bachelor degree from JSS Dental College, Mysore, and I have done my masters from Udaipur Pacific Dental College. So after completing my dentistry, studying in dentistry, I have started my job profession from Hyderabad, and I feel blessed to work in Hyderabad. And I have almost worked in all the corporate companies like Clove, like Partha, like big chains I have worked. I wanted to learn not only the dentistry, I wanted to learn the business also. So after learning and getting it polished, I have started my own setup. And Caracare is basically a polyclinic where we work on dental, skin and hair. So it's a new setup, started 2 years back. Now it's located in Kukatpalli, JNTU, opposite to JNTU metro station. So yeah,
That's great, ma'am, because of course your kind of studies was in different places. You started from Mysore, then you are doing your kind of courses in Udaipur. Right now you're in Hyderabad. That too, her clinic is very opposite to JNTU metro station, just like 1 minute walk. That's how close Caracare clinic is. So yes, ma'am, now we are just moving to the interview questions. So the very first thing, whenever we go to a dentist, which comes to our mind is root canal treatment. So root canal treatments are now frequently happening in each and every city, not only in India but also around the world. So tell us about your experience in root canal treatments, and also your specialization in endodontics. So tell us, ma'am, what made you inspire in this totally different kind of stream, that endodontics, because people just know dentist, but dentist and endodontist, it's totally different. So tell us about it, ma'am.
Yeah, it's a great question. So endodontics, what made me to choose endodontics? Dentistry is very, very big. So many branches, and every branch plays a major role in dentistry. But I prefer to choose endodontist as my profession because the first thing what you noticed is when the patient enters to the clinic, they are already suffering with pain. So endo means I'm gonna relieve the pain for the patient. So most of the time, patient visits to me with the complaint of pain, and the moment you relieve the pain, they give you a lot of blessings. So it's a pleasure to relieve pain for the patients, and endodontist had taught me a lot of patience. So all this procedure is very, very needs lot of precision and perfection and lot of patience. So endodontics is anyone who is doing endo practice needs lot of patience. Yeah, that's how it made me to proceed, and every day is challenging. Every day is a new day for doing different kind of work. I practice all kind of thing in dentistry, but endo is one of my favorite.
So of course, each and every patient coming to her clinic, they are coming with some kind of problems. So once they enter the clinic, the problem is totally disappearing. It's vanishing. But the stream endodontics is the thing which makes people disappear and vanish the kind of inner struggles. So that's the thing you're trying to do. That's great, ma'am. So also there is a lot of advancements, there is a lot of technologies arising in this endodontics department. So each and every month there will be like something or the other which will be upgraded all around the world about this endodontics department. So people because you have already been in the stream for past 2 years. So tell us about the latest advancements and also the technologies updates which you want to tell regarding this department, endodontics, ma'am.
Yeah, I have been working from 7 to 8 years now. So, in dentistry, endo is like a chain where every day is some new things will come, and we need to get updated with every new advancement. So, to make myself updated every time, I do attend new different kind of conferences. I go to femdent, and there itself we'll get to know the new materials and how to apply those materials into dentistry. So dentistry is more of quality work. So if I am updated with all those new materials, I can use it into my dentistry and make patients also feel good. So if I practice in a quality of work, definitely patients will be happy and they'll be coming back to me for any kind of future. If they suffer any kind of problems, they'll come back to me.
So yeah, that's what I told in the beginning of the interview, that most of the people, whenever they come to a dentist, so 10, I think 8 out of 10 people, they'll be going through this root canal treatments. So tell us, ma'am, what is the most common thing which causes these kind of root canal infections? So there must be this common mistake which each and every people they'll be doing, like it may be the kid, it may be to the middle-aged person or the old-aged person or anybody, they'll be doing these common mistakes which will ultimately lead to root canal infections. So whenever we just come to you, tell us how do you actually prevent and how do you actually eradicate. Of course, we can't eradicate the entire thing. Of course, whenever you come to a doctor, there must be some kind of things which we should come again and again. But tell us all as a single thing. What is the thing which we can do to avoid root canal infection so that we can just stay in our homes and will not be coming to dentist? So tell us about it, ma'am.
Yeah. So the basic problem of root canal infection is negligence or ignorance. So every teeth gives you a sign that there is some issue. Once you start developing kind of food lodgement or kind of sensitivity, at that step itself you should walk into the dental clinic and get it treated. If you are waiting that okay, things will get sorted one day, so that one day is never gonna come. So immediately go for a routine follow-up checkup and maintain a good hygiene. Like every 6 months you can plan for a professional dental cleaning, and minor small cavities you can get it filled. That's very simple thing. But once you ignore it, that bacteria is still there in the form of cavity into your teeth. So that's gonna completely damage your teeth, and the nerves which is there inside the teeth will get infected. That's how you develop the root canal infection. Yeah.
So these things are a little bit scary actually, because even if we have any kind of sensation with our single teeth, then you're advising people it's better to have kind of appointments with dentists so that we can just actually eradicate even before it starts.
Yes.
So I think root canal infections, we should take a healthy care of our teeth day to day on a daily basis. Because we should not think, that's only a single teeth. So what will, even I am just thinking right now. So I'm just feeling some kind of things, like before 1 week I just felt like one teeth was not good. It was little bit like paining for me. So right now whenever you're telling that, it was like scary things to me. But the thing is that no need to worry about anything. Our Dr. Parul Pandey ma'am is there over here. So people who are in Hyderabad, so they can just visit. Especially people who are near Kukatpalli, Dr. Parul Pandey ma'am is there to help us out. Most of people will be fearing about the things which we have to go through whenever we are going through this root canal procedures, because there will be filling, there will be like there will be drilling over things over there. So they will be like, ultimately they will be scary, as I told you before. Like consider today, like today's generation, they will be like taking it in an easy way, but people like before 10 to it's like 3 decades back, like they're born in 1970s or 80s, like the old age people, they'll be little bit like scared, like what will happen if the treatment doesn't go well, and what will happen after I drill my own teeth. So to those patients, to those people, what will be the thing that you would like to tell, and so that they'll be thinking like, okay, root canal treatments are just like a normal procedure, no need to worry about anything. So it will be just going just a week or after a week. So tell us about your procedures related root canal treatments, ma'am.
So, root canal treatment in a basic language where everybody can understand. Root canal is nothing but we are going to clean the teeth from the top to bottom. So, the nerve which is there inside, which is making the blood supply to the teeth, we are going to clean the teeth from top to the bottom. So, the nerve is already infected, so we are going to clean the teeth, and then next step will be, after cleaning, we will be disinfecting the teeth. We'll be putting some medicament inside the teeth and we'll be disinfecting it. And the last step will be filling of the teeth. So the filling is done from top to bottom. In root canal, the filling is done from top to bottom and removal of infection is done. In a normal cavity and a root canal, the difference is that normal cavity will proceed with cement filling, cleaning of the cavity and cement filling. But root canal is a big procedure, and it's like sometimes the patient also develops some kind of sensitivity just for quite 1 or 2 days. But it's not a scary procedure. You are going to save your natural teeth. So getting it removed, natural teeth, if you are removing it, there is no replacement. Better to proceed with root canal and save your teeth. Yeah.
So that's a kind of simple way of explaining the root canal treatments. Of course, if anything happens to us, the very first thing which we'll do is cleaning. That's what we are just doing with our teeth. Of course, whenever we play in the garden, like in the football stadium or something like that, whenever the players get hurt, the very first thing we just do is clean the wounds. Then we just put some medicines over it. In the same way, whenever we are just coming to root canal treatments, it's a very simple way of cleaning, then filling with medicines and all these kind of procedures. Of course, I don't want to go deep inside it so that it will be even more scarier. So it's a very simple thing. And also, most of the people like who do not have any kind of trust. Of course, people trust each and every day's kind of people who they meet, but whenever they come to any kind of health related problems, they will be having another kind of thoughts that what will happen if this root canal treatment doesn't go well. So what happens, this root canal treatment will be a failure for us. Of course, the thing is that the dentist who actually treats us, they're actually professional, they just go through everything. The thing is that our teeth, we are just totally worried about our teeth. They're just doing their best what they can do, but it's our teeth which has to kind of hold the kind of strength to regain its normal strength. So to those patients, what is the message would you like to tell? So about the success of root canal treatments, and also what do you want to tell so that they don't need to worry about the things that will lead to kind of other issues like failure of root canal treatments. So tell us about it, ma'am.
Yeah, so this is also a good question. So one very, very important thing, when you proceed with a root canal, you have to trust your dentist. Don't do a lot of Google search. Lot of Google search will misguide you. There is a lot of myth about any other treatment, but you have to trust your dentist and choose a good specialist for your treatment, right? So whenever you go with the root canal treatment, as per guided by your dentist, take the proper medication and have patience, and within 1 week or 10 days of time, proceed with a good crown over it. Because once you finish the root canal, after that, if you don't put the crown into your teeth, then what are the chances that the infection might reoccur, or you might, while biting hard, you might break your teeth. So to give the strength to your teeth after the root canal, try to plan for a good crown. Quality of crown should be good. That's how you can save it for lifelong. Yeah, and one more thing is very, very important. Once the treatment is done, go to your dentist and get the x-ray done once in a year, so that you can evaluate that your root canal is very good, in a very good condition. And after doing the root canal also, you can start chewing naturally how you used to eat your food. Then there'll be no sensitivity, no pain. That's a sign of a good quality of root canal. Yeah.
Of course, when every procedures are over and if you do not feel any kind of pain, then the procedure is a success. And also at the same time, yeah, of course, it's a good message that each and every people who go through these root canal treatments, of course, each and every year, it's better to take a kind of x-ray so that they will be kind of making themselves sure that everything is going in the right way. That's what you're trying to tell. That's right. On the other hand, you also told that whenever we just come and visit a dentist for root canal treatments or any other treatments, please do have a kind of trust. Of course, whenever you're going to fly in a plane, whenever you're just going to travel somewhere, you should have some kind of trust in the pilot.
Right.
Whenever just going to travel in the bus, if you have a trust in the bus driver. So each and every day you should have a trust in the people who are actually coming there to help you in some or the other way.
Right.
So that's the first thing. It's not only about the dentist, it's about everybody. So we should have a trust and everything will happen according to the universe. I do understand it, ma'am. So now we are just going on to a different topic, pain management and complications. Of course, when each and every patient comes for root canal treatments, the first thing is they will be having a lot of anxiety. Okay, what's going to happen? They're just going to operate my teeth. What will happen if it's not going to go well? What will happen if there is a lot of pain emerging? So because we know about our own teeth. So at that point of time, how do you actually make sure the patients are in a calm mood? They're just not going to kind of worry about anxiety. And of course, the main part is pain. Pain management is very, very important, of course. So tell us in which way so that people can actually don't need to panic about this root canal treatments. They never needed to have any kind of anxiety. They no need to worry about the pain. So tell us about the pain management and the anxiety part, ma'am.
Yeah. So this is very, very important question. So when patient reaches to me, he is already anxious, he is already in pain. So the success of your treatment depends upon the confidence which is there in your dentist. So if your dentist is confident to do the treatment and to justify what kind of treatment he is doing, then half of the pain and anxiety goes off from the patient. So ideally, me being a dentist and me being a specialist, what I do is when patient comes to me, I will first do a proper diagnosis and I will explain. I will show him the X-ray and I will explain what is my procedure, how I am going to proceed. And there are 2-3 protocols. Like I do proper anesthesia technique so that the entire procedure becomes painless and comfortable. So the entire thing which is developed in patient's mind just goes off. So after his first session itself, they'll call me and they'll tell that my entire pain is gone. So one thing which we expect from patients is just follow the proper medication, and once the treatment is done, don't try to do experiment on your teeth. Don't try to bite hard items immediately. Once it is complete treatment is done, you are good to eat all kind of teeth. When your dentist gives you a positive sign, then it's good. So anxiousness, definitely, being a patient, anybody will be worried and tensed about their treatment and the entire procedure. It goes in 2 sittings, 3 sittings sometimes, but it depends upon which dentist you are choosing. Your dentist should be professional and experienced.
Yeah, it's a very simple thing. Of course, whenever you trust a person who is actually thoroughly professional and having a very wide experience, vast knowledge in it, no need to worry. We just leave it up to their hands. Let them do their duty. I remember a very famous story with Ratan Tata, sir. What happened is that they were traveling in a private jet. Correct. And at one point of time, they're flying through the ocean. They were in the middle of the ocean. And one of the engines totally failed. And after 5 minutes, what happened is that both the engines have failed. And what happened is that the other person he is a great businessman, he also was sitting with Ratan Tata, and at that point of time, he was sleeping. And he even texted his kind of own relative, I think his son, if I'm right. So I'm just in a private jet and we have just lost 2 engines. The thing is that he was just telling to make sure that what is happening. But Ratan Tata was totally calm. And at that point of time, he told a very simple message, simple words. Let the pilots do their duty.
Correct.
Yeah, in the same way, no need to worry about anything. Whenever I just come and visit a professional dentist, like whenever you're just going to meet Dr. Parul Pandey ma'am over here, let her do the duty. So everything will be coming and aligning in the right place. So also, people also ask the other question like, tell us ma'am, what are the complications that may be arising after root canal treatments? What are the potential complications? Something other may happen. So tell us about it, and how will you actually handle them so that people will be no need to worry about the thing. The only thing will be which will be kind of doing rounds in the mind is very simple. What will be happening to the extreme? So those are the potential complications. So if we know the information, then if we know actually how you're going to deal with it, then patients will be still more clear about it. So tell us about it, ma'am.
Yeah. So one thing is that any treatment we start, there are complications also, and there are pros and there are cons also. So once we start the treatment, some procedures are like in case of long standing infection, imagine if the patient was having the infection from so many years and suddenly he reached out to me, I started the procedure, then I have to inform the patient that there are chances of him getting the swelling in his face or swelling around the tooth. So all these things I pretty explain my patient before itself. So whenever I see the long standing infection, I take a proper x-ray and I show it to the patient that this much of infection is already there. So when I try to do cleaning of that infection, you might develop some kind of pain, you might develop some kind of sensitivity or swelling. So accordingly, I will prescribe the medication to the patient, and prior itself I'll tell, don't panic, within 1 day or 2 days it will subside. And then immediately I'll do a periodic follow-up, I'll do call the patient and check if the swelling is subsiding and what is my next step to proceed. I will clearly explain my patient. Yeah.
Yeah, it's very simple. So top to bottom, first Dr. Parul Pandey ma'am is here to help you out to know about yourself. So then we'll just go to the treatments. And also tell us, ma'am. So there is a lot of things happening, and can you share some of the most complex things, procedures you must have done, and also what are the challenges you have been facing like during the past days? And also tell us about your success testimonials that you wanted to convey to the people. Of course, each and every day we should go through ups and downs. It's our duty. So tell us about the most complex cases that you have dealt with, and also about the success stories that you wanted to share with the people, ma'am.
Right. So I have seen, I have met with patients who have got prior root canals, and they have come to me with dislodged crown. So they have lost their crown long back, and suddenly they have developed some kind of pain. So after the root canal is done, the crown is lost, the infection again rebuilds up. So that time it becomes a challenge. To repair that root canal becomes a challenge. Or sometimes the patient reaches to me that I have got my root canal done, and now I have developed swelling, I'm not able to chew on that side. So when I clearly go through a close view, there is some kind of mishaps in the sense some root canal was not done, not performed properly. There might kind of some instrument which is broken inside the root canal, and it is left out, and the patient is nowhere, he doesn't know that information is not given to the patient. So that becomes very unethical. So me being a dentist, I try to repair that, and I give that positive hope to the patient, and I also tell them the probability that how long these teeth will survive. I don't give them any false hope, but I tell them that this is the current scenario. I will repair the teeth, but how long it will survive, I cannot tell you the guarantee about it. So that's how the challenges comes to me, and I am always prepared to sort out. Yeah.
That's a great thing. Of course, the very first thing you told that you are totally genuine, you're totally professional. You're just letting people about themselves know about themselves. That's a great thing. And also, each and every person who was having a wide knowledge in their profession, they should be rating themselves according to the industry standards. So tell us, ma'am, when you actually rate yourself to the industry standards of root canal treatments, so tell us about your success rates. So what do you want to tell the great about yourself, so that people will be able to have some kind of genuine trust, and they'll be happy to know about you, ma'am?
Yeah. So this is one great thing I'll tell you about treatment protocols. So I follow the basic, I follow the max of sterilization protocol. So I make sure that everything is super clean and hygienic, and I try to give the best quality of treatment to my patients. So whenever they go from after taking the treatment from me, if they even travel somewhere outside India and they move, walk into a dental clinic, that dentist itself will tell you that this kind of quality work is very good. So my priority is to give you a quality of work, and always I'll be available for that. So anybody who's having suffering with these kind of issues, they can reach out, they can ask, they can feel comfortable to call on my clinic number. I'll be available for the treatment. Yeah.
That's great, ma'am. So right now we are just totally moving to the different question, different kind of understanding about dentists and their treatments. So yeah, ma'am. Each and every day, as I told you before, there are developments happening in the technological field in each and every department. And of course, when you come to dentistry, so there are a lot of 3D imaging techniques happening. And also, you are just dealing with a lot of microscope works. So tell us about it, so that people will know about the latest advancements that's happening in the dentistry field, ma'am.
Yeah. So yeah, 3D imaging helps us a lot. So when we plan for the treatment, so 3D imaging gives us a clear how big is the infection. The clear three-dimensional image is visible to us. So when you want to locate the infection, the size of infection and how much it is extended, we can easily locate with the help of three-dimensional imaging. So we plan the treatment after we check out the proper three-dimensional imaging. We plan the treatment, we plan for implant, we plan for bone graft, and everything we plan according to the three-dimensional picture. And microscope has added a very good advantage for us. So microscope means it gives a magnifying image to us. So when we work into the site, the things are very small. So when we work under microscope means we are getting a magnifying image of that site. The work becomes more precise, and assumption, the word assumption, we can remove it, and being practical, what we can see and we can do it. So definitely microscope has added a great advantage in dentistry. Yeah.
Of course, microscopes starting from our childhood are known to kind of elongate. Like if you want to make a kind of good visibility, then you have to go through it. Then we'll be able to sort out what's actually happening in the tiny world.
Correct.
So yeah, and also about speaking about 3D techniques. And of course, each and everything has to be kind of known. Of course, when I have seen this movie called Iron Man, so the Tony Stark, the lead of the movie, he will be doing everything in 3D kind of technique. It's a very old kind of thing. Like in 2007, he used to do it. Nowadays it's kind of very old. Like it happened 2 decades back. Yeah. So nowadays everything happens in 3D. Of course, not only dentistry, if you go for any construction kind of apartments or any kind of things, whenever you look into 3D kind of thing, we'll be able to sort out what's actually happening. So as I told you before, there are a lot of advancements and happening in the endodontics field. So tell us about the latest advancements which actually make you feel very excited. Yeah. And it will actually help people in curing the kind of diseases which they have in the body. So tell us about the inspiration about the latest advancements, and whatever you wanted to tell, you can tell, so that people will be feeling even more like, okay, I'm just feeling a little bit comfortable after knowing all these kind of developments happening. Because 20 years back, it will be like whenever you're going to doctor, you'll be feeling like, okay, what's going to happen? Yeah. Nowadays, everything advancements is happening, and because of that, everything is getting a little bit comfortable. So tell us about it.
Yeah. So putting all these advanced materials, we are trying to extract the fear from the patients. So my most inspiring thing is that I like to work on laser along with the endo. So when the laser comes into endodontic practice, means a lot of infections are easily sorted. Laser light can pass on through the infection, and we can clear out the infection very easily. So in case of long standing infection, we also use the laser activation. So laser assisted root canal treatment is also performed nowadays. So you can easily plan for laser treatment. That gives very good result. It's an advanced technique. And one more thing is more inspiring, which is still upcoming and studies are going on through it. That is stem cell therapy. So, that kind of regenerative therapy. So, when all our knowledge and all our practical thing doesn't works, then we try to put some regenerative therapy. So, we extract the blood from the patient and we try to take out the growth factor from that and try to use that growth factor into a regenerative process in the dental things. So that's also very much inspiring, and I would love to work on it, and I love to study more on it. Yeah, that's how it goes on. Yeah.
Yeah, I'm being a biology student during my high school days. I used to wonder about what's going to happen in the future in this stem cell therapy because what to say, there are a lot of movies which has happened already. They'll be taking this particular thing from a different, it may be from the DNA or it may be any part from an animal, and they'll be trying to regenerate the damaged part. So that has to lot to do with the stem cell therapy. Of course, even more like after a decade later, we can just expect a lot of things which people can use to actually eradicate the diseases in a very simple manner. Tell us exactly how do you actually communicate with the patient's treatment process. There will be a lot of things that you can actually give it as an option so that they can select accordingly. Of course, each and every category will be for their own health, but you will be giving a lot of options for the procedures. Yes. And there will be a lot of things that you wanted to communicate with the patients before doing with the procedures. So tell us about the communication part, ma'am.
Yeah. So communication in the sense when patient reaches to me, every step I guide them. Every step before starting the treatment, I guide them. This is the things I'm going to perform and what is needful. What is needful for you? So if your teeth is infected, what is the treatment which is needful and how important it is? So I clearly explain my patient, and I expect from my patients, there are many patients who from 4 years, 5 years, they come to my clinic on regular basis. So I guide them the regular hygiene maintenance protocols, and in the sense how to keep it as clean as possible. So what all you can use on your regular basis, like mouthwash, like which brush to use, what is the good technique to brush, and after every cleaning I guide them. I sit with them, I spend time with them, I guide them, and to be honest, my patients are very happy. They reach out to me in every periodic follow up. So yeah, that's how even you can maintain a good hygiene. Just don't ignore those basic signs, like if food is getting stuck in between the teeth, and then you are trying to put some toothpick in between the teeth and trying to clean it, that's gonna create more space, and then some other issues will start. So dentistry is not very costly, but ignorance is costly. Once you start ignoring the things, it becomes a major issue. So maintain a good hygiene, go for a periodic follow-up, and when you reach to your dentist, just don't compare the cost of your treatment. So imagine if I did a treatment of worth of 2000 rupees and someone else has done the same treatment in 500. So don't compare the money in that or the cost of treatment. Compare the quality of treatment and compare the comfort. What kind of comfort the dentist has given to you. So that's how the dentistry works. Yeah.
Yeah, that's a vital thing which each and every patients and each and every people coming to you, they needed to do. Of course, each and the kind of comparing started with our early age. So it's better not to compare because each and everybody are skillful in some or the other way. And when it's come to a dentistry kind of thinking, the thing is that never need to compare your health treatment with others. It's totally different. What your health is undergoing is totally different from others' health. So that's the base point which I wanted to kind of put in forth in everybody. So also tell us, ma'am, we have spoken about everything. So in between you are just telling that how to actually brush and what paste should we use. So still more, there are a lot of people going with the kind of traditional methods. So people nowadays are just fearful about the toothpaste that is existing in the market. Of course, there are a lot of good paste, but what would you suggest? Like, what will be if it's in a traditional way? Like, if it's not going to do with the paste, then what are the methods in which we can keep a clean teeth, strong teeth, and also at the same time, what are the foods should we actually eat? And tell us tooth powder or toothpaste. Like most of people are like early people, like as I told you already, like people like in the 1980s, 1970s, they'll be using tooth powder. They'll be telling that okay, toothpaste it's a kind of chemical component, but tooth powder it's a kind of Ayurveda herbal, the traditional methods going on there. So tell us all about that you wanted to tell regarding maintaining a very good hygiene and strong teeth, ma'am.
Yeah. Yeah. So when you compared with the toothpaste and tooth powder, toothpaste anything you can use, but when you are purchasing a toothpaste, just turn it around, and it should have a International Dental Association. It should be recognized. So FDA recognition or IDA recognition, if it is recognized means it has a proper content in it. So when you compare with a kid or an adult, so kid will have less amount of fluoride in their toothpaste than compared to adults. So that's how the toothpaste selection should be done. And next is mouthwash. You can use mouthwash on regular basis, either once in a day, dilute it with little water, and try to gargle and use the mouthwash. And mouthwash can protect your teeth from cavity and plaque deposit or food deposits. And try to brush 2 times in a day. And if possible, instead of using toothpick and other things, use water floss. Water floss can help you out to remove the plaque or food deposit from your teeth. And yeah, soft brush is more recommended. So when you use hard brush or a wrong technique, you are indirectly damaging the enamel of your teeth. So try to use a soft brush with the correct technique of brushing. Either you can use a circular motion or a technique which will guide you on the next video. So use a proper good technique, and don't do hard brushing. Be gentle on your teeth and give just 2 minutes brushing is more than enough. Yeah.
It's a very simple thing, but explained in a very detailed manner. I do understand, ma'am. So yeah, we have spoken about each and every question, and yeah, one last question for this interview is very simple, ma'am. Via this interview, if you want to kind of tell any kind of message to the society, it may be to the kids, middle-aged person, elderly person, it may be to anybody. What will be that one particular message that you want to convey to the people via this interview, ma'am?
So in this interview we have discussed a lot of dental treatment about it, but on a basic language I want to tell you that for your kids, make a habit that they go to your dentist in every 6 months or 8 months, so that they are also aware of dental treatment. They are not scared of dental treatment, they are aware of dental treatment. So make a habit to your kids. And for yourself, maintain a good hygiene, go for a good cleaning on a regular basis. Every 6 months you can plan, you can schedule for your teeth cleaning. And for your older ones, like your parents, your grandparents, those people, they are not able to chew food properly because their teeth are not functioning properly. At that age, they are not worried about their looks, but they are worried about the function of the teeth. So if they are not able to chew the food properly, then the nutrition is not reaching to them. So my request is that for those parents, guide them, reach out to your dentist and try to find out a good solution for them, something which is permanent. They can chew, they can maintain a good hygiene. Yeah, so that's how you can help your parents. And for yourself also, you should be quite aware about the regular maintenance habits. Yeah, in case if you want any kind of checkups or follow-ups, you can directly reach out to Caracare. I'll be available from almost morning 10:30 to 8 o'clock. I'll be there. So anytime you can call my clinic number and you can directly book the appointment.
Yeah, that was a great kind of things that we have actually discussed in this interview regarding dentistry department. So people who are watching this interview, do subscribe to Women Today channel. Please do click on the bell icon so that you can receive notifications whenever I do post new videos regarding women entrepreneurs and working women across different cities in India and also across different countries in the world. So today's your host is Krishna, hosting this Women Today YouTube channel, and today's our guest is from Hyderabad. Her name is Dr. Parul Pandey. She is the founder of Caracare Clinic, which is situated opposite to JNTU Metro Station in Kukatpally in Hyderabad. So yeah, thank you once again, Dr. Parul Pandey ma'am, for allowing me to host this interview. That was a great knowledge which we had from you regarding this dentistry department. So good evening, ma'am. Have a nice day.
Thank you so much for listening, everybody. Yeah.
Yeah, that's a wrap.